come on in. I know that we'll probably have people joining us here over the next couple minutes, but let's just kind of kick things off. And obviously today the topic is healthcare, resilience and recovery, and how not to become the next victim of healthcare cyber attack. Clearly, there's been a lot in the news as of late, and how timely that we have Chris Patillo and Ron Sims. Chris is the president and CEO of Rhyno Healthcare. Ron Sims is a strategic business alliance partner and probably two of the foremost experts in this space. So you guys want to join us. And then, there's clearly going to be a lot that we're going to cover today, guys, and there's no way we can cover it all. That's why this is going to be part one, and obviously a series of probably 5 or 6 over the next several months that we're going to do. So, with that, let's kind of try and jump in. Ron, maybe you can kind of get us started.
And Terrence, before Ron gets us started, I just mentioned there are no experts in this space because it's constantly changing. So, we have experience, but expertise is something that just continues to grow in this area.
I love it. Fair. Ron.
Yeah. And it's funny because we use the word guru and expert so loosely anymore, right? So, hi, thanks, Terrence, for transitioning over to us. You have Chris and Ron. I'm going to talk and put the overall high level in there, and Chris is going to drive us right into some of the deeper points. The bigger question is, why me, right? Why am I speaking with regards to this? And the focus of me is I'm a lot about structure and framework. I'm a lot about preparedness, responding and less reacting. And I'm a lot about reality, right? My goal today is to speak a little on why this is happening at a high level, the challenges, and how to win in general, and then transition to Chris for our 3-legged table approach, a little deeper dive into it. So first, who's affected? Part of a conversation in our healthcare has been Change Health, Accenture, Google, Facebook, on and on and on. It's not just the finance markets. It's not just social media or disruption to our supply chains. It's all area. And now healthcare has become in a spotlight where data cripples. If they can get to our data, it allows them to have a much more robust set of information about individuals and overall. So healthcare providers, payers, third-party vendors, it really doesn't matter as long as there's data behind it. Anything that touches a network or is in a server is a target. Why? Data access today is as good as money in hand. We watch the movies, we see ransom, right? We got your system, you let it go for $10 million. But also there's identity theft, which you guys are combating on a routine basis. Your bank says, hey, you got this fraudulent charge. Selling lists, we don't think about this, but selling lists of personal information is very, very much a market in the United States as well as global. How much more robust is the information if they align what healthcare has with regards to PHI data? So the challenges we face, and part of the reason we're having this discussion is what happened and how can we protect it? So the challenges are relying solely on existing protections, vendors, and feeling safe. Chris opened and kind of said there's nobody as experts because everything's changing, evolving. That's part of the false sense of security that we believing that existing protections are sufficient and can lead us to complacency, making our organization vulnerable to new emerging daily threats. Vendor limitations, even trusted vendors, and the big names that we started this conversations can have security gaps, or more importantly, may not address the specific cocktails to get to their vendor information or your organization. It's a shared responsibility. Cybersecurity is a shared responsibility, and relying solely on vendors overlooks your critical role, your team's critical role, internal policies, employee training, and regular system assessments and audits. And Chris is going to talk about our 3-legged table approach that touches upon each of those. Anyone who knows me knows that I like to win. That's my focus. And I take that terminology and I apply it to everywhere. Anyone else who also knows me knows that if I have wicked smart people, and that preventing cybersecurity or any other project or things that we work on, it's just work. It is hard, diligent, and a lot of work, but it's just work. My oldest daughter is a teacher, a softball coach, a trainer at a high-level travel team and a high school team. Why do I say that? Because she says one thing in all of her speeches to her athletes, her student athletes, parents, coaches, and whoever she trains. And it's the same for us, our preparedness. Practice, adjust, practice, adjust, practice, adjust. We're going to spend a fortune. We're going to have a lot of time and a lot of physical capital for just a very short game. In softball, one error can lose the game. In our world, one missed penetration can cripple our systems. Cyber threats is a constant evolving with new vulnerabilities and attack methods. We love to watch the movies on terrorists and hackers, but they're one and the same. A hacker, a terrorist, and I hate to say it, a disgruntled individual, and everything in between makes us vulnerable. And it only takes one opportunity out of a million. So what's the difference between a hacker and all those? Is hackers are in a comfortable air-conditioned room behind a high-powered PC, working to get to your system and your teams. However, you all have wicked smart companies. You have a wicked smart team working to see those people trying to penetrate your systems. It's not a one team responsibility, so it's not just the vendors. It's a partnership with vendors, internal routine tracking metrics, which Chris will touch base on, external team audits and assessments, and I would also add into this a little humility. Continuous vigilance and adaptation are required to be effective and protect our systems. And technology, again, I'll say it, literally changes every day, just like a number in an equation. I know it's cliche. Cybersecurity, cyber risk management needs to be embedded in organization culture as part of everyone's job on focusing on process, protocols, and have our responsibilities on risk assessments. In addition to culture awareness, this means ongoing training of recognizing and responding to security threats is crucial. And I'm a propeller head, and I'll probably say this to all of our IT propeller heads. It's necessarily for you to communicate to these individuals who have to go to that training and in a sexy, awkward way, making it palatable so that they want to be aware and communicate to our executive that this is important. Compliance and regular updates to security protocols is essential. Chris will touch more on the governance piece. Frequent security penetration assessments, audits to identify areas of potential weakness. This means money, time, and again, humility. If you think you're completely safe, you've already started off on the wrong foot. Staying informed about the latest threats and emerging issues to be prepared and respond is important. I know that what happened in Europe with one of the cyber threats made people freak out over here in the United States. A proactive approach keeps defense robust, adapting to the ever-changing cybersecurity landscape. And lastly, defensive disaster planning assessments, internal and external, and penetration drills are essential. The organizations do disaster preparedness drills, so should you all. Terrence, I don't know how I did, but before I turn it over to Chris on our three-legged approach, anything I need to address?
No, in fact, this is a good, transition. Thank you for the intro, by the way, Ron. So, and one thing you talked about is in terms of like the preparedness. And I know you guys have a really good scorecard that you guys have put together. It's like a 5-minute type of thing where people can walk through. If you're watching the replay, it's called scoremycyber.com, scoremycyber.com. We'll put the link in the comment section too. I think that's a good first step. And to your point, right, it's constantly evolving, but at least understanding and preparing for where you're at today allows you to kind of figure out what you want to do as an organization moving forward. And Chris, Robin obviously talked about this kind of three-legged approach and three-legged, stool to the table. Maybe you can kind of start us off there, give us kind of that overview of the three-legged approach, and then kind of dive deep into those.
Yeah, let's start at 20,000 feet and then work our way down. Now let's also do this because each one of those legs, we can go deep. We can spend 40 minutes, 50 minutes on each one of those easily. So if I start going down a path in too deep a direction and someone's got a really good question, just stop me.
Okay.
I'd rather answer questions and keep this interactive conversational than just me talking for the next.
And just on that, Chris, just before you get started, again, this is going to be one of a series that we're going to do. And if you have questions that that you have now, put them in the comment section, or actually there's a part in that scorecard in the Score My Cyber at the end. You can put that in there, things that you want to hear us cover on subsequent ones that'll be happening over the next 6 months. So I just want to jump in and add that.
Perfect. And feel free to stop me anytime. But let's start with the three legs. So as Ron said, what we've learned through our experience, And clearly, I would never call myself an expert because we just learned. I'm an IT guy from years and years and years and years, and we just happen to be working on a lot of resiliency and recovery work. And we started to see these trends, and we started to see these key components that needed to be put together. And interestingly enough, it's not just technical, it's not just business, it's not just governance, it's not just financial, it's all of them. So if we were to take the three legs, and each one of those, as Ron said, you're going to hear I'm going to say the word business as usual a lot in this. If this isn't integrated as a business as usual process throughout each of these, then you're only going to solve it for a period in time, and 3 weeks later, a month later, a year later, you're already behind the eight ball. If this is not business as usual, you will fail. So let's start with proactive cyber risk management. Now, it's interesting. Cyber risk and cybersecurity are two different things. So we'll talk about how you can proactively figure out what is our risk as an institution if a cyber attack happens. What are our financial penalties? What can we accept risk? What risk do we have to remediate? And what risk do we have to insure? We'll talk more about that. The second leg is taking all your governance and your procedures and your policies. How do you liaison between the technical work that needs to be done for setting up the proper frameworks to what is the business impact? What is the understanding? What is the priorities? What are your tierings? And we'll talk each of those as well. That needs to be documented in a policies and procedures that is strong, revisited regularly, updated, both between the group that owns the governance and the teams that they'll be speaking, which is both business and IT. And then third, there is the technical piece. Where we start, obviously, was on the technical side, and that's how do you build out the proper frameworks? We'll talk about it a little bit. You'll see in the background I have a little poster, follow the framework. Your application is not special. It took me 30 years to get to that point. I'm an application guy by heart. Each one of my applications were little children to me, so they were all special. And we had to learn over time that, if everyone's special, then nobody's special. And in a recovery environment, if you take it as everyone's a one-off, then you never get recovered. So you'll hear me say that again. Follow the framework. Frameworks are critical in this type of environment. All right, those are the three legs. So again, it's cyber risk management, it's your governance and your procedures and policies, and then it's your technical resiliency and recovery.
What do you think is a good one to start with, right? So obviously, and I know you've talked to me before about, this M score and some different ways to kind of get an initial assessment. Is that a good place to start? Maybe kind of.
Yeah, let's start there, because that's going to do one of two things. First of all, it's little technical. It's more operational and about your business and about some of the financial risks you'll be willing to incur. And what that does is that gets your CFO aligned, both understandingly and financially, meaning creating budgets that allow you to do the work that you need to do. And let me tell you a quick story. This is kind of funny. So we've been doing work in resilience and recovery for about year and a half now. We've obviously touched it. We've done a lot of data center migrations. We've done a lot of application rationalization projects and things like that. But we started to get involved specifically in resilience and recovery. And as we were coming to the fall of 2023, we were talking with our customer and said, this is going to take through 2024. It's going to take us into 2025. Here's what we need to budget for resources. And oh, by the way, we're probably going to need at least $10 million to fix the gap in technology that you have in your disaster recovery data center. And the person on the other side of the line just laughed and said, that's never going to happen. $10 million. We can't even get you $5 million in our budget. And we knew that. We knew that at the time that was whether appropriate or not, that was the answer we were going to get. Jump 9 months ahead after Change Health and some of these other events. We just had a presentation with the organization and said, you know what? 10 million was low. It's more like $15 million. And nobody blinked an eye. They're like, give me the number, make sure it's right. I'm going to the board, because $15 million in technology spend is nothing compared to the financial loss that would happen if we get hit with a cyber attack. Not just the financial loss, but also our reputation. And that's what you see with these other organizations.
And isn't it unfortunate, Chris, that sometimes we, in our lives, across different industries and organizations, right, that we need those catastrophic events to happen for us to realize and understand the financial ramifications that can happen, if, right? And sometimes it's not if, it's a when, right?
Well, and I think that's been the challenge. When disaster recovery was only about catastrophic events, it was, oh yeah, we have to be prepared if a hurricane or something blows up or something like that. But it was okay, how often do we have a hurricane? How often is it going to take it down the entire data center? All right, maybe power goes out for a couple hours. We'll figure out those types of things. It was an important but. And you know what? We're going to build 2 data centers far enough away. We'll be safe.
And I think that's the big shift in the market right now. It's less reacting and more the executives want to invest so that they're prepared, so they can respond in a minimum way.
But just having 2 data centers 1,000 miles away doesn't do it anymore. A cyber attack gets you anywhere you are.
Let me ask you guys how much of it in the boardrooms and the higher levels of these healthcare organizations, how much of this talk now is driven from the financial standpoint? That's what I found interesting. Chris, I know we were talking about at one point in terms of the CFO being involved, but like how much of this is being driven from the financial, shareholder value, standpoint?
I think so. Let's talk about the first leg then. I mean, because I think CFOs would think it was a CISO's responsibility, as Chief Information Security Officer's responsibility to make the institution secure. That's not the case anymore. So what they're doing now, and there are tools for this, and there are scores for this, and there are ways to evaluate this. They're doing full risk resiliency assessments. And what this means is you can come in 30 and 60 days and gather some data from your security team, but more importantly, gather data across your organization. And this goes across your people, your industry, your situational needs, your infrastructure, your applications, and your organization. And you can take all these pieces and you put together what's called an M score. Now, an M score is trying to become more of an industry standard. I think it's got some time and energy to get there. But what it is it's a quantifiable number that will tell you where your risk lies. And that number, it's a number between 0 and 1,000, and it's 0 to 250 is poor, and so on and so forth. 750 to 1,000 is good. But what it breaks it down to is 3 areas of decisions that need to be made. One is, how much risk are we willing to accept? Here's our outcome. Are we willing to accept this portion of the risk? We know it might happen, but we're okay with it. Okay. How much of this risk do we need to remediate? Because it can be remediated through technology, through process, through documentation, through governance, whichever. And then finally, how much of this do we have to go and insure? Because, we can't remediate it. It may happen. It's going to be catastrophic in value. How can we make sure we have the proper insurance to cover ourselves that way? And each one of those 3 then become work streams that need to be managed throughout forever, and have budgets and have ongoing reviews and have potentially, testing events, those types of things, in order to make sure that things are working. It's not a one-off. So a CFO that goes and does this 60-day evaluation, great. You're doing the right thing. The board's going to be happy. Nice presentation, all kinds of good things. But what do you do from that? That becomes your business as usual, and make sure that you're prepared, not just for now, but a year from now, 5 years from now, 10 years from now, et cetera.
So let me kick that back to you. What is, right? So like that CFO who has done that, 60-day evaluation, goes to the board, right? They kind of look and understand maybe where their weaknesses are in terms of from a financial liability standpoint. But, where from there?
Well, that leads into the second leg. So let's talk about your governance. Let's talk about your policies and procedures. Those are critical. One of the customers that we're working with had a beautiful, well-written, well-documented policies and procedures from a business standpoint, from what it needed to be as far as what happens when an event occurs, who's responsible, who's going to own it, what type of procedures need to be followed. That's that piece. That piece is interaction between a team, and that team needs to be defined within your organization. It could be something within IT, it could be something within the business, it could be something within the executive team, and the business and IT. So what happens in these meetings are things like business impact analysis. Every business line in the organization should understand their business impact analysis and document it. And again, it's not a one and done. You don't just do it once a year and go, okay, we're covered. And the next year you look at it and go, it's good enough. We're just going to check off the box. I'm busy right now doing 5 projects. I'm not going to review it. That's fine.
And Terrence, this is where I'm also focusing on, we need to make it sexy. We need to make it attractive, right? Because for a CFO, they got dollars and cents. Mm-hmm. From a IT perspective, security perspective, it's like, yeah, okay. So, okay. Like people, or it's the sky is falling, right? So it's somewhere actually in the mean. Maintenance and routine stuff is, is going through the process, having the governance, and saying, here's what's happened in the last 5 months, and here's what potentially will happen in the next few months, in a way that doesn't make my eyes glaze over.
So let me ask this, and and you mentioned something, Chris, in terms of like a cross-functional team that involves all people in the organization. That to me is one of the ways to make it a little more sexy, Ron, right? And that it's not, and I want you guys to correct me, not that it's the CFO and the finance, problem, not that it's, oh, that's the CISO group, that's their thing, right? To where it's a team effort across all the parts of the organization.
Culture is the word I like to use.
It's culture, and if each business line isn't engaged just as much as the financial team and the IT teams, it's doomed for failure. And I'm going to tell you why. There's a lot of different reasons. So what happens in this business impact analysis? So let's take a payer, for example. They do claims processing, they do membership enrollments, they do all these things, all critical events. They get pharmacy for their patients. They have data that transfers with their doctors to help reduce cost of care. All these things are critical things. You go to this business for your claims processing. How fast do you need to be recovered? And they're going to say, oh, we're tier 1. We have to be tier 1. We have to be recovered in less than 4 hours. Well, think about that. Every business function in your organization has to be recovered in 4 hours. Is that really a reality? Secondly, what's the cost to build something that's recoverable in less than 4 hours? Is it even technically feasible? Because so let's talk about. I'll pause back for a second. Let's talk about tiering for a minute. There's things with resiliency recovery called RTO, recovery time objective, and RPO, which is your recovery point objective. Your RTO means how fast do you want to be recovered? Is it tier 0, which is instantaneously? Is it tier 1, which is typically less than 4 to 8 hours? Is it tier 2, which is 8 to 24 hours? Is it tier 3, 4, 5, which sometimes is best effort types of things? All those will determine what is your technological solution for bringing that back up. If it goes back to that story. If everybody's a tier 1, then nobody's a tier 1, because you can't recover everybody in less than 4 to 8 hours. It's just not going to happen. Or you've got to have an active situation where you've got a data center that you can flip over 100% in 4 hours and everything's ready to go. It's just not both operationally and technically feasible. So now you've got to break that down with your business. Say, okay, really, what are your business functions? Which one of them are critical for the immediate response, and which ones, a member can't pay us for a couple of days. You know what? That's not great, but we can live with that. A member can't get their pharmacy. A member can't get to their doctors. That's much more important. So those are the discussions that have to happen within this part of the realm. What is the business impact analysis? What is your tiering requirements? Let's talk about recovery point for a second. Recovery point. So if recovery time is how fast can you recover, recovery point is how much data are you willing to lose once you recover. So, for example, if we have a backup and restore solution that only backs up once a day or once a week, you're going to recover and you're going to lose a day's worth of data or a week's worth of data. Your strategy, your architecture will be defined based by your RTOs and your RPOs. Now, what will happen is the business will say everything's got to be tier 1. IT will come back and say, that's ridiculous. It can't be tier 1. Oh, even if you have an organization where IT says, okay, you're saying it's tier 1, here's the cost for us to build you a tier 1 solution. It's going to cost $25 million one time and $5 million annually for upkeep. That's the conversations that now happen. What is truly the need for the business to recover? I worked at NYU in the years when Hurricane Sandy hit. I know what a disaster is, and I know when things go down, and nothing really recovers in 4 hours. You're just lucky if you're getting everybody operationalized and situated in your networks and everybody logged in. All those tier 0 types of events have to happen before you even start recovering. So you might say I'm 1 4 hour recovery, but let's be realistic. Depending on the event, it's not going to happen. So you need to be able to understand what are your procedures and processes to, one, set up your command center, get all your people engaged, get your end users logged into some sort of remote device, get everybody aligned, and then you start systematically bringing up your systems.
Can I ask you something? And I'm just thinking from an organizational standpoint, and I think the question I would ask is, obviously you guys work with large healthcare organizations, and what in terms of like best practices that you've seen them employ, right, or help them employ in terms of this, whether it's a cross-organizational group that is doing these type of things, there's a lot there. There's so much there, right? And so from, like both from the finance standpoint, from the prioritization standpoint, right? And those aren't conversations that just happen over lunch that you go, hey, yeah, yours is a higher priority than mine. You're good to go, right? So maybe if you guys can talk to us a little bit about what you've seen in terms of the large organizations that you've worked with, and some best practices that you've seen that they've employed in terms of that, and how to go about.
And that'll vary, obviously. So we focus mostly on the providers and the payer side. Totally different types of requirements for recovery. One is direct patient care. So there's a certain level of emergency that you need to get that up and running. What are your downtime procedures? How do you provide appropriate patient care while the systems are down? On the payer side, again, pick and choose what are your most core important businesses. What are the ones that are going to impact your members? What are the ones that are going to be the most impactful? Again, pharmacy, not being able to get medication, scheduling, not being able to get procedures scheduled, claims processing, those types of things hit the top of the list. And even within those, as I said, there are more important parts than others. Does your portals need to be up and running, but does every feature on your portal need to be up and running? So what happens there is you need to have a team of both business, technical, and financial representatives that come to an agreement of this is our rule, this is our run book. If something happens, this is the orders of events that we need to follow. And that's where your policies and procedures come from. That's where everything should be laid out. It shouldn't be oh God, something happened, what do we do next? It's oh God, something happened, turn to page 1. Yes. And page 1 and page 2 and page 3 and so on should always be updated so that you can get to the right responses. And it's interesting because we'll get to the third leg in a second. What's in that documentation about how to get your command center operating, how to do your communications with your business, how to get everybody contacted and aligned is different than the actual steps to the recovery piece, which is the technical piece.
Before we leave that, let me ask you guys, Ron, and maybe you can jump in this in terms of that group, right? As you guys mentioned, nothing is static in this. So organizations really should be looking to formulate and form this group that is going to be carrying on for the foreseeable future, right? There's not going to be less of a need for this group and team, right? Because things change so rapidly. What does that involve? Who does that involve? And what are some of the initial, and I guess we just talked about some of it, but what are the conversations that maybe even the executives should be having in terms of who to involve specifically in that type of group?
Yeah, from an organizational approach, it's not just like our security penetration. It's not one answer fits all, right? So depending on the size of the organization, depending on even a small little company has to think about this type of thing. And from that perspective, it's taking that assessment on the penetration, but also taking that assessment on our partnerships. Whether it's a vendor partner, how quick can I get somebody on the phone to fix it, or it's a external partner to tell me how I can address it. Combining all that information, and if you don't have a CISO or a CIO, depending on your size, is being able to present that package and saying, here's what it's going to cost us to invest in this. But I had an old CIO from years ago who taught me is that the bigger answer is, here's what it's going to cost us if we don't, right? Being able to make that projection and pull those metrics together then tells you who you need to take it to. Your first stop always, I would sometimes say it's also your last stop, is understanding your CFOs and stuff like that, because they'll need to figure out the budgets, but the dollars of investing should not be driving the answer in which we need to do. It's the dollars that we're trying to protect that's out there. One system down for X number of time, how much revenue is lost? How much revenue is lost around downtime procedures and bringing all the information back? All the hands on deck. Oh, we've got robust downtime procedures. You really shouldn't need them as much as we possibly can. Right. So the answer to that question is, if I'm in a large organization, is working with our chief level to say, here's what we want to put together, making that sexy, presenting what the problem is in the past, how can we address in the future? And that always becomes a board investment. Do we want to invest in this? Do we have the right structure? And presenting that policy. The new term is center of excellence. For whatever word you want in front of that, right? PMO center of excellence, cloud center of excellence, all those center of excellences, whatever terminology brings people to awareness and makes them feel part of it at executive and the levels down is what we need to put in our organization and start presenting. So if I'm a small one organization kind of thing, it may just be saying, hey, we need this number of dollars. Here's what we're protecting. Here's what we can live with. And here are our partners. If I've got a SaaS organization that's really small and it takes me a day to get them on the phone, that's a problem, right? If I got an organization that I have alignment, my vendor partner, who now is attacked, that disappears, that's a problem. Assessing your relationships, assessing your internal, and presenting that as a package of here's the money it costs, here's the time it costs, and here's what we're going to potentially save, and not in the ways of, hey, we're going to save billions of dollars. The reality check of what you're going to save will tell you who you need to bring to the table. Because if it's a CIO who says, yep, invest, boom, done, it's easy. If it's a CFO, CIO fight, it's a little more difficult. So, I would say it's not a simple answer to your question, but the straightforward perspective is follow the money. The money will tell you who you need to speak to start with, so that you can start to say, here's my obstacle in the organization. Chris, how am I doing on that one?
No, you're 100, and you mentioned something. I do want to get to the third leg in a moment, but which we will. But you mentioned something very important about the partners. So you're going through all your RTOs and RPOs, and you're arguing internally with what's tier 1 and tier 0, and et cetera, and recovery times, and trying to make things that are feasible to your members. And then you partner with a company that says, you know what? In your contract, it says our DR policy is best effort. Our DR policy is 5 days, 5 weeks, whatever. And you're stuck with that. And that might be a key part of your business. Let's take Change Healthcare for a second. They're a huge processor of data for a lot of these organizations, and them not being able to do their piece impacted everybody's business. So you not only have to do it internally, you have to do it externally as well. And that's a very strong vendor contract management team that needs to be able to work with that. And you take companies that are huge that'll say, I'm not building a separate DR solution for you. I've got one for everybody. It's a challenge.
Sounds like your weakest link. Go ahead.
To the weakest link concept for a second is that governments spend billions and billions of dollars to protect the millions and millions of times that are attacked. It takes one. So to put our partners, even if we have turnaround times, and say that they're going to be able to handle this, doesn't allow us to be lax on our policies, our procedures, and our data set of redundancy, because it just takes one, right? So Change and Google and all those, they are the poster childs of look what could happen. But the reality is they spend a lot of money to do this as well. So, for us as organizations to assume that we're not going to have to invest, or we can just give it to Terrence's team, is kind of like, little hubris there.
Okay, so before we move on to the third leg, I just want to plug. I know you guys have done a great job, putting together that resilience and recovery scorecard. It takes 5 minutes. You can go there, fill it out. It'll give you an assessment, kind of a quick benchmark as to where you are and where you can start. It'll also give you an opportunity to kind of plug in there and give us some comments or questions that you want us to discuss in more specificity. Is that a word? Yeah, specificity.
It is. It's a hard one to say, but it's a good word.
Thank you. Maybe I just tripped over it.
But I stay away from it because I screw it up every time.
And here's a perfect example why, right? Stay away from the big words. See, I learned something, Chris. I should stay away from the big words. But with that, let's move into, Chris, your follow the framework. You mentioned the poster behind you. That's a big part, right? So let's talk a little bit about that. Kind of this is that third leg of the stool. So maybe if you can kind of
and this this is the bread and butter of what we do, but obviously one leg doesn't work if the other two aren't balanced as well. But if you've done your risk management and you've done your policies and procedures, the next step is, okay, what do we need for it from a technology standpoint in order to make this happen? Obviously, you need a place. A data center goes down, you need a place to recover to. Now, you have to have the proper amount of security. You have the proper amount of infrastructure. This is where you start building out your frameworks. Now, your frameworks what that means is, goes back to exactly what we said. I'm not going to worry about recovering my application based on that application. I'm going to recover that application based on which framework it falls under. Is it Wintel? Is it Linux? What type of storage does it use? Is it AIX? What type of integration does it have? Is it a private cloud, meaning that it's an on-prem data center application? Is it a public cloud application? Is it a hybrid, which is one of, has information crossing both? All those things will be based into your frameworks. And what you're going to start building out is a tier 0 framework. And tier 0 means always on, essentially. So something happens, there are core pieces of infrastructure that need to be lit almost immediately in order for you to start recovering. This might be, say you're an OpenShift user and you use OpenShift for a lot of your application development and rollouts. Maybe you have a standby OpenShift cluster in your disaster recovery center that's always on. Maybe it's in a small limited fashion, but that you can flip on immediately and don't have to worry about bringing up to turning on in a phased approach. Think about it. If it takes you 4 hours to stand up your tier 0, you've already missed your tier 1 recovery times. So there are certain things that will be at that tier 0 framework. A lot of that is your integration. A lot of that are your security pieces. A lot of that is the pieces that you need to have functioning in order for a data center to be alive. Then you build your frameworks for your applications, but you build them on a tier level and a technology level. You're going to bring all of your Linux systems up together. You're going to bring all of your Wintel systems up together. You're going to have a process for that is not just repeatable and structured, but can be handled by any IT person who happens to be on call that day. How many of us have been sitting there going, oh, geez, only Charlie knows how to fix that. Oh, he went on vacation yesterday. Get him on the phone. We need this up and running now, and nobody else knows what to do here. And it happens way too often, unfortunately. These frameworks, these documents, these recovery procedures, this all leads into let's first stand up the command center. Let's get everybody engaged. Let's have our communications between business and IT. And then how are we going to make this happen? And you're not losing time screaming and hollering, who's here from the AIX team, who's here from the Linux team, who's here from what? You just have a process that brings everybody to the table. Now, that means, just like we talked about the policies and procedures in the governance side, every one of those policies and procedures will equate to an IT recoverable document. And there might be 40, 50 of these that need to be not just created, but need to be maintained. Some things, this is one of the sad things that happens in the life cycle of IT, because every project runs too long, doesn't get to do everything you need it to do. Scopes change, budgets change. And by the way, you got 40 projects sitting behind that waiting to go. So what happens towards the end? What happens? DR is like, oh, we'll worry about DR later. Let's get the system live. Recovery procedures. Oh, we know what we're doing right now because we've done it 1,000 times. We don't have to have documentation done. And then what happens is 6 months later, it's still not there. A year later, it's not there. I won't name the application, but with one of our customers, it was an application that got an exception to bypass DR, and if they will take care of it next year. Well, next year was 4 years ago, and they still don't have a DR solution for it. So those are the types of things that happen in this technical piece. And this is mostly IT. This is your infrastructure team. These are your applications teams. These are your roles and responsibilities. Who's responsible for making sure that this documentation is up to date, reviewed, and most importantly, tested. So all this, everything we've done. So you built out a data center. You built out integration, network connectivity that goes between everything. You have ways of doing testing. You can create a network bubble if you have to in order to do a DR exercise. All these things have to be worked out. And then you need to do regular, repeatable recovery exercises. Today, we're going to take out claims. Let's see how fast we can bring it on board. And in reality, in a perfect world, your disaster recovery data center and your primary data center shouldn't really matter. If you flipped over your disaster recovery data center, you should be able to operate there for a period of time to be determined. That isn't hours. It might not be days. It may be weeks and months before you flip back to your primary. And it shouldn't really matter. Primaries and secondaries should become less important. It's active, not active. So all those things have to happen just as much as understanding your risk and your financial implications, understanding your policies, your business impacts, your tiering, your requirements for recovery, and then technically how we're going to bring everything live. And each one of those is work that just needs to happen on a regular basis.
How does that happen, right? In terms of I always bring things back to accountability, right? So what's the way to bring accountability? I keep, again, if I'm sitting in, at the C level of a healthcare organization, and listening to you guys, my first thought is we've got to put a group together across, organizational group that is going to be that's going to be their focus, because, just like anything, everyone's busy. Everyone has, financial and operational goals that they're going to hit that get driven down at the beginning of the year, and I keep coming back to thinking that there needs to be this group that's their sole focus constantly. It's just not going to go away.
Well, but that's just it. It can't. So from a governance level, you're correct. From an operational level, it can't be a group who it's their focus. That focus has to be everybody.
Yes.
Let's go back to BAU. One of the things that happened was, development teams have to develop code. There are constant new changes, new functionality, new business requirements, et cetera, that have to go in. There, especially in the world of healthcare, there are regulatory requirements that you don't get I can't delay the regulatory requirements. CMS is not going to allow me to. It's got to be live on April 1st. Here we go. So they go off and they do what they do best, and they get things done, and they move forward from crisis to crisis to crisis to crisis, and then this thing falls to the wayside. The training has to be that your responsibility is not just to development, not just to setting up infrastructure, not just to putting functionality out there. You have to build the disaster recovery, your resiliency into it. And if you're not doing that, then you're not doing your job. What is that going to do? That's going to increase budgets across the board, because everybody's got a certain amount of work they've got to get done. Every business line has things that's got to get done. Well, you can't, if you just, once you start building this into it, you're going to need more people. You're going to need more infrastructure. All these things are going to be required for you to do it appropriately. So what it's going to do is really lay out what your true costs are and what your bandwidth and your throughput is to get projects done.
And I'm going to add a little to it, because we're talking a little bit, and it's almost kind of like Chris mentioned about the CFO, right? We're good for this 6 months because we've invested, and here's what we have. And reality is, majority of the conversation Chris is having and we're having is how to get you there. And we keep lightly touching on ensuring that we stay there, right? So when we're talking about testing, penetration, or going through those drills, that's dollars and cents. That's hands on keyboard. That's actually a CFO operational line that needs to be there. And then more importantly, in my mind, it's an internal perspective on reviewing that information aligned with an external who doesn't care about your organization, doesn't care about what you think on stuff, but says, are you doing it well, right? When we look at what you did, how fast things turned around, did it go well? And then that's a routine. So that's an investment that organizations don't always want to have happen, right? So, and I don't want you to see what's in my closet of dirty laundry right behind me, but we need to have those people aligned with our organization to say, here's the problem, here's some things, here's what I see today, and can you shore that up? You're missing this playbook. What's the look back period for your disaster recovery plans? What's your look back period for your downtime procedures? How far back have you looked at that stuff? Have we run this through an exercise? And we're going to do all that stuff in December, this day, on a not so opportune time. Like, these are kind of conversations that you have to have. The different definition of high availability as opposed to backup, nearline cache, all those definitions need to be understood. Chris mentioned active high availability cutover. I've had conversations, organizations where, okay, we want to get out of this data center. We want to move to cloud. I'm like, okay, flip you to the one data center you're okay with, and let's just go with that one now being your primary. Yeah, but we know when you start get to those yeah, but conversations, you're not as resilient as you potentially think you are, because you haven't run through those exercises. I've also done, before we've done upgrades or cutovers, I always say, have we taken our systems down and up? Have we rebooted our systems? And everyone gets nervous about a rebooting of a system because that means downtime, but importantly, they're a little nervous if it'll come back up. So having those operational discussions, investing in those time, making them government policies, mandates that you must do XYZ every year, and ensuring that the vendors are aligned and ready there, not an additional cost kind of things, is part of that overall playbook. It's a second part of it. It's an expensive part that no one wants to pay for. It takes time, it takes money, and again, it takes humility to say, look and tell me where I have some weaknesses.
Speaking, let me ask you guys this. This is a little bit side topic in terms of the weaknesses, but obviously, artificial intelligence, AI, LLMs, all those things are becoming more and more prevalent, and I would think that those are creating just great opportunities for cyber hackers out there to make their job even easier. Does that come into play in terms of the finance piece, the capital investment side of things, to go, hey, I know we've always needed to, and we do need to on an ongoing basis, and put OpEx into the budget for that. But is that not accelerating not only the urgency, but also increasing the budget line item for organizations, for healthcare organizations, because of the just dramatic increase in
I'm
I
going
want
to
to make a statement real
say,
quickly, Chris, before I punt that to you. The challenge that we're having is that we're looking at AI as this wonderful thing that's going to solve a whole lot of problems, right? So when we utilize AI, there's two ends. There's opportunity and there's cost. By leveraging AI, we allow us to be able to work faster, work better in those aspects. So does the other side, right? The other side is able to use the same technology that we're using, except with our supercomputers, which is just basically our phones, and more. They can do it quicker, right? So AI allows more penetration in because we're leveraging it, and we don't really realize that it's just a really fast if-then loop, but we're allowing that opportunity, and people want to use that more. We're attaching that on. We're also going to smaller companies that are utilizing that information that may not have as robust systems and backups to what we're doing. So I want us to think a little bit AI, what it is, right? It's unknown, it's growing, it's ever changing daily, but it's also another area of vulnerability for us as an organization. Sorry, Chris.
No, that perfectly led in, but at the same time, this is where you get into your cyber risk, cybersecurity part of the equation. There are tools that a cybersecurity team will have that monitor all your network traffic, all your requests for access, do phishing expeditions with their end users to make sure that they're educated, they're not clicking on the wrong things. So yes, does AI pose a potential to multiply on that? Yes, but it only takes one of any of those events to break things down. So you have to have that part of your infrastructure in place no matter what. It's interesting, if done appropriately, and I've seen this in action, people do something incorrectly, not on purpose. They open up a website they shouldn't, whatever, and they're getting dinged within seconds. Either they or their bosses. Why is this person doing that? And that's when you've got the right cybersecurity infrastructure in place. And then hopefully it's strong enough to capture the multiplicity, which is another one of those interesting words, that AI will bring to the table.
What was the one I used? It was similar. Multiplicity. There's a lot of ICITIs that we're using.
Anything with ICITI scares me.
I think we've exceeded our ICITI
there you go.
Words. Let me ask you guys this. In terms of what are the questions that you're hearing as you're, talking with these organizations, these healthcare organizations, whether it's, at the director, C-level, whatever you want to say, what are the questions that they're posing to you? And what are their big concerns in terms of things? You guys are, again, I'm going to use this for a lack of better, like you guys won't say it, but you guys are the experts, right? And so as a, leader of an organization, they're relying on you to not only bring your expertise, but what you've seen in terms of best practices with the large organizations that you've worked with. So
the biggest question. So let's get into a couple levels down. Let's get into the people that have to implement. Let's get into the people that have to document. Let's get into the people that have to do the work. The biggest question they all have, and this goes back into your app is not special. And your app is not special because it integrates with 7 other apps, and it pulls data from here, and it gets data input from over here, and it integrates with this system so wonderfully. I can tell you how to bring my application up in the 15 Windows servers that we got it running on, but I can't tell you what it's going to do when I just bring it up alone. So how do we get that information? How do we understand the integration points? How do we understand the key technology pieces that have to be related to that business impact analysis? So let's go back to the business now. The business says everything's tier 1. Well, okay, you were successful enough to get them to say, well, not everything's tier 1, but I need these 3 functions in order to recover appropriately. All right, well, those 3 functions require this application, this database, this storage system, this set of data coming in from one of our partners, et cetera, et cetera. And then that becomes the recovery exercise. And so to answer your question, the question we get is, well, how are we supposed to know all this? How do we know how all these things integrate with each other? And this is where tools are out there to build what's called a CDMB, which is a catalog of all your systems, or a CSDM, which is a database of all how your systems talk to each other. So you can say, if done appropriately, you can actually pull up a business function and understand all the pieces that are needed to make that business function go. And then you can use that information to build your recovery documents. So you see, it's all layers of building. Without these tools properly implemented, then you're taking institutional knowledge from 4 different people, locking them in a room and hoping that you're getting it all, and that one of those people isn't on vacation that week and you miss a key part that you forgot to recover. But so to answer your question again, the questions we get is, how do we make sure we know everything? And that goes back to, are you building your systems? Are you building your database? Are you building your knowledge pools? Do you understand the business with your business partners? And that's that ongoing effort that we keep talking about.
Ron?
No, the only thing that I keep jumping on in my mind is, I'm going back to I may be dating myself, the TV series Tool Time. Having a tool doesn't always
Tim the tool guy, right?
Yes. Having the tool sometimes gives us a false sense of comfort, right? But as Chris is identifying, there are layers and layers that you potentially have. It's not one tool. I can't use a screwdriver. Well, I can use a screwdriver to be like a hammer sometimes, and I have.
We have,
but one tool is not going to fit every area, and it's also that portion that people get a little nervous about the investment in that tool. If you have a robust, I'm going to use the word playbook, you have a good understanding of your stakeholders, including your vendor partnerships, and you have that external team and the metrics that Chris is referencing, and truly an understanding of your entire organizational structure in your data world, you're in a good starting point. And then the reality is that investing in that, working through that process, and having an ongoing review, maybe it's 6 months, whatever that is, allows you to stay ahead of the game in this world. Now, the challenge for us is, something goes bad, we need to be able to respond to it, not beat ourselves up, shore up the hole, and then move forward, kind of thing. So, Change Health and the other ones that we started this conversation out with allowed us the opportunity to take a hard look internally and say, what aren't we doing regularly that allows us to be a victim of this, and use the word victim, and how can we shorten or lessen our exposure or the impact of this situation, right? It's not about, I have the best product, or I have the best in breed, or I have 20 breeds, or I have one technology. It's really about understanding what happens if this little clip or this big clip goes away. As Chris said, what can I do out for a half a day or 2 weeks? What is the impact to my organization? And does it mess with my core mission as an organization, right? So if my CRM package goes down for a day or two, does that cripple my core mission? If you're in that business, it does, but if you're in the business of healthcare, are my patients okay? Am I able to get the data I need to the providers? Is the doctor who's operating on the table seeing the technology and seeing what they need to do? Is that okay? And then peel the onion from there, kind of thing. So
what are some, like good timelines? I'm just sitting here thinking about, we've talked about a lot today. There's a ton that we're going to continue to talk about. These aren't problems that we can just pull a magic bullet from our bag and solve, right? So maybe talk about, and again, we're all humans, right? So we're always like, okay, what's the fastest way I can get there? What's the least painful, right? I'm just being honest, right,
yeah.
Ron? Like, what's
the minimum work we can do?
Let's really boil it down, right? Like, and again, so maybe let's talk just if you guys have some opinions on that in terms of like, hey, like, a lot of this is overwhelming. We don't know where to start. We're we agree. Everything you've said, Chris and Ron, I totally agree. Holy crud. Where do we start? How do we get there?
Let me give you an example. So a little over a year ago, when we were brought into an organization to start looking at the resiliency and recovery, specifically around some risks that they were having, nobody knew what they didn't know. And so we started some discovery work. We worked for a couple months. We came up with gaps, and we came up with foundational work that needed to be done, and we came down with technology work, and we met with the CISO and the CIO, and we all came to agreement that these are the 4 pillars that now need to be addressed. That took 4 or 5 months just to come up with the 4 pillars that need to be addressed. Then they were like, well, how long is it going to take to address this? Well, it ain't going to be done in 2024. We said we can do a lot of it in 2024, but it's going to go into 2025 because you can only do so much at a given time. Your budgets will only allow so much. Your manpower will only allow so much. So we wrote an SOW up for beginning of 2024. That was very generic because nobody knew, just like you said, nobody knew what we were going to find when we started peeling the onion. So we wrote an SOW up that was like, we're going to start with this group and then this group and then this group, and we're going to see what we find. And what that allowed us to do is peel that onion on a regular basis. So now when we're doing a renewal, now we have 7 major work streams that we're working across. And now each of those work streams is going to have its own lifespan and life cycle. And someone, I was on a call the other day, and someone from the company said, well, is all this going to be done by the end of 2024? And I said, no, it's not going to be done by the end of 2024. It's going to go into, hopefully by the end of 2025, we'll be in a really good place. But don't think that this is a short win here. This is ongoing. And then if we do this right, by the end of 2025, it's incorporated into your business as usual culture, and then it becomes life cycle into your company. So there's no quick win here.
You mentioned a statement. We've given a lot of information, and we've only given the tip of the iceberg, right, of information. I'm Ron Sims. I have an organization, and I'm trying to figure it out. Now I'm overwhelmed. So I start off with the conversation. Why me? Why am I starting this conversation? Foundation. Have a plan, start to put things together, right? So you walk away, your first statement is, what do I know? What don't I know, right? And then I take that information and I say, well, what do I need to figure out? And that's, I hate to say it, that's internet searches. What are the key things that I need to do? What are some of the things I need to start with? Develop the plan that you want to do your first 3-4 steps. Identify what it is, and then what happens is you get the how. How can I address these 3, 4, 5 steps? Then get an external kind of says, hey, what are going these 3, 4, 5 steps? And they tell you more. It's a rinse and repeat cycle. Chris made the statement that we had an organization who said, come look at us. It took us 5 months to kind of get us into a specific situation. And from that 5 months, took another X number of months, and it's just going to keep going through. The challenge for us is not become complacent where we think that we're good, right? But the first step is figure out, have a plan that says, I need to identify what I want to look at today, and then how can I look at that today, and then tomorrow is what else do I need to look at, and that'll ultimately grow, which will create your budget.
Which will create your budget and hopefully build you a way to spin when you come up with new information. I think Ron said it, and one of the leaders of the companies that we work with is like, we're going to find something out 6 months ago that we got wrong. We did this assessment of what the gap analysis for a data center. Oh my God, we missed this. Yeah, okay. So now what do we do to fix it? Because you're not going to get it right out of the gate.
And this is a good lead into the scorecard you guys have set up. A good plug for it. The healthcare resiliency and recovery scorecard. That's a good place to start. 5 minutes. You can go in. Ask you some questions. You answer. You can also give us some feedback. On what you'd like us to talk about in the subsequent events. And as we wrap up here, guys, obviously, like we've talked about many times, there's way too much to tackle in 1 hour of time. We've covered a lot of ground, but as we kind of wrap up here, before the next event that we do specific to this obviously topic as well, what are some closing thoughts that each of you have?
Ron, you want to start?
Yeah, I mean, my closing thought is I'm going to use this terms in more of a layman way. I tell anybody, don't beat yourself up, right? The reality is sometimes we know what we know, and then the other reality is we know what we don't know. And we're very much enamored and connected with our technology. And I always just hold up my phone and have a conversation and say, you know how much you do in this phone. You're vulnerable in that phone. You lose something, you miss something. Fine. Just figure out what you want to do, figure out how to address it. Start to put the framework, the plan together, which will ultimately drive you to the who, the what, the when, and the how much. So, don't beat yourself up, regardless if you're responsible for this piece or the overall. Just pick up where you've started and keep moving forward.
Let's just end it with, don't let perfect be the enemy of good. And a very wise man teach me that when I was 30 or 40 or whatever. And for every solution, if you try to make it perfect, you're never going to get anywhere. Make it good and then make it better.
And with that, I will say you guys are experts. And again, I think what I view people who are experts, not in necessarily just only their subject matter, but the ability to ask really good questions. Like, to me, that is what's the most important part. You guys know the right questions to be asking, because that's really what your role is, right? Is to find the areas of weaknesses that you can help organizations fix. And so, well, you guys won't say it, I'll say it for you. You guys are the experts. Chris and Ron, I greatly appreciate your time. We'll look forward. We're going to, to the next one. Keep an eye out, by the way, anyone who's watching this, watching the replay. Again, for the scorecard, go to scoremycyber.com and then keep an eye out. We'll be in communication with you to let you know when the next one, probably in the next 5 to 6 weeks. And we'll have a series of these. This will probably be one of about 6 that we do here specific to this. But guys, I greatly appreciate your time today and your expertise.
I appreciate everyone joining in. This was really enjoyable. Thank you.
You bet. Thanks, guys.
Have a good day, everybody. Have a good weekend.